Now, for the tubular obstructions resulting to acute tubular necrosis, you need to know that still on this our diagram that we did, we can have an obstruction distal here. Is it clear? If you have an obstruction distal here, it is also going to damage at the level of the tubular cells, because you're going to have accumulation of the excreted and the secreted product here. Is it clear? When you have accumulation of the secreted products of the tubules because of this obstruction in the collecting duct, you're going to visualize that you're going to have damage directly to the tubular cells, which is still going to cause acute tubular necrosis. Now, the question that you have to ask is, what is capable of accumulating there in order to cause the damage? Is it clear? The product that can accumulate there is usually a crystal. Is it clear? The crystal can be crystals of calcium, generally calcium. Is it clear? You can have crystals of calcium. You have the second one, you have oxalate. So we have crystals of oxalate, we have crystals of uric acid. Is it clear? Crystals of uric acid. And then the next one, we have crystals of ammonia. Is it clear? Crystals of ammonia. Now, the question that you have to know is that what? Generally, you have crystals of calcium when somebody suffers from hypercalcemia. Is it clear? So somebody that has hypercalcemia is still going to have acute tubular necrosis by the mechanism of the formation of crystals at the level of the blood, at the level of the tubules. Is it clear? Now, somebody that has gout, is it clear? Both acute gouty arthritis or a chronic gouty arthritis is also going to have a tubular damage. Is it clear? Is also going to have a tubular damage, and I'm going to explain more the tubular damage when we're going to visualize chronic kidney disease mechanisms. Is it clear? Now, the next one is going to be ammonia. Now, ammonia is going to be much more related in a condition like liver cirrhosis. Is it clear? So when you have ammonia when you have tubular damage in liver cirrhosis where you don't have portal hypertension, you can also think of a case of ammonia, which can be excessively secreted. So those are the different conditions that you have to visualize now when you think of an acute tubular damage from a tubular obstruction. Is it clear? And then the last one, this is when it is at the level of the renal pelvis, the proximal obstruction. When you have a proximal obstruction. Is it clear? Now, in case where you have distal obstruction, like in the case of a urinary tract obstruction, anything like a bladder outlet obstruction, like particularly in the case of benign prostatic hyperplasia, in the case of a prostate cancer, or other things like a ureteral stones, or other things like urethral stones or kidney stones. Is it clear? You need to know that this distal obstruction are still capable of resulting to the kidney failure form and the mechanism of acute tubular necrosis. Is it clear? So those are the different things that you have to visualize for how you have a pathogenesis in the mechanism of acute tubular necrosis. Is it clear? Now, the next thing you're going to visualize now is the mechanism of interstitial nephritis.